Hello and welcome to CMR TV. My name is Tamsin DC Weinstein and I'm going to be bringing you the AI way. This week I'll be telling you about the latest developments in the world of AI. Whether you're using it in the boardroom or just want to learn about how to use AI at home, there's something for everyone. I'll be interviewing global leaders who are using AI to change the world, but also local people who are using it in their daily lives. Let's dive in together and ride the AI wave. Okay, thank you all for coming. I very much appreciate it. So we have an excellent speaker tonight. When we did the first one last month, lots of people wanted to know about AI in healthcare, health and wellness. So we have a very fabulous AI expert with us tonight who I've been following on LinkedIn for a couple of years and who has literally skyrocketed in the last 12 to 18 months. Literally, I followed your career path on LinkedIn. You are doing amazing things now. So thank you so much for doing this for us. And we've told Harvey that next time we're going to fly him down to do it in person. So yeah, tonight we have Dr. Harvey Castro. I'll do a short intro to him in a second, and then I will give him the floor. And then at the end, I think I said last month, we'll do an open mic lightning round. So if there's anyone on the call who wants to introduce themselves or network or find out about anybody else on the call, we can have a bit of time to do that at the end. And then, sorry, let me just admit these people. And then the next 2 months, I've already got the speakers lined up. So January or February, I don't know which way around it's going to go yet. One of them is going to be a practical hands-on workshop where I have a guest speaker. I won't tell you who it is yet, but some of you may have heard of him. He's a global speaker on AI, and he'll be doing a practical workshop on using AI tools at work. And if you have your laptops with you, he'll be walking you through tips and tricks on how to use, he'll probably do ChatGPT for business efficiencies. So that'll be a really good practical one. And then we're also going to do a workshop, which is about AI in education and how it's changing the education system and the kind of things you should know, mainly based upon adult education and how you should all reskill and how the world is reskilling. So that'll be the next two, just so everybody knows what's coming up. We also have a WhatsApp group. So I don't know if everybody's on it. If you are not and you want to be, here is the QR code and the link. I can also share that afterwards. I don't bombard people. I use it really just to send things like trainings or workshops or podcasts or anything that I think people might be interested in. Because a lot of people want to know about upskilling and the kind of resources they should be using. So I send them on this and I invite everybody else to network and introduce themselves and share resources as well. So it's just another way for us all to learn from each other. So yeah, please do scan that or I can send the link out afterwards. Okay, so now on to the main man. Our guest tonight is Dr. Harvey Castro. He is an emergency medicine physician and a leading AI futurist with over 2 decades of experience. He's a chief medical AI officer, and he is one of the things he's absolutely brilliant at public speaking. So he's done lots and lots of TED Talks. He's on the TV regularly in America. He's an author. He's written many books. He's a thought leader in AI in the health and wellness sector. So he really is massively inspirational. And like I say, I followed him for some time on LinkedIn, and there's not many people doing it to the extent that he's doing it. He's massively passionate about AI and how it can change everybody's lives. So I would invite you to go to his LinkedIn, go to his website, follow him, see what he's doing. You will learn a lot, genuinely. I actually stole this picture off your LinkedIn, AI generated image. So again, this is just some of the things he's done. 5 times TED Talks, 25 years in emergency medicine. He's got 15 AI healthcare publications. And I mean, it said over 100 speaking engagements, but it will be way more than that now. I've seen he's constantly on the road, speaking on TV, radio, spreading the good word. So I will hand you over to Harvey. I'm going to attempt to share his. Oh, do you want to try sharing your presentation first? And if you
Yeah,
can't,
let me pull it up real quick. I'll put it on this screen because sometimes it works, sometimes it doesn't. Let me hit slideshow, current. Oh, crap. Let's see. Share screen, window, that one. To share audio, you need to put it in the Chrome tab.
you want me to share from this end and I can control it?
Yeah, if you don't mind. I'm
I don't
sorry.
mind. Oh, no, I don't mind at all. I might as
Yeah,
well make myself useful.
you're funny.
Okay, 1 second. Let me get it up. I need to tell everybody as well, I'm recording this meeting just because some people who couldn't make it wanted to know if they could have a recording. Does anyone have any issues to that before I carry on? Because I don't want to record without consent. Okay, perfect. Thank you. Okay, let me share.
All right, and make sure the sound is going.
There we go.
All right, I'll start off by saying yes. My face looks all crazy because had a mad moment and I did a chemical peel to see, and it started peeling, and I'm like, I don't care, whatever. But I don't want you to think I have some weird disease. Like, man, this guy is not real good. He's sick. So no, it's just a chemical peel, my friends. All right, so let's start. Let's play the video on that first Arnold. Just hit the little arrow underneath the picture if you see it. If not, don't worry.
Let me see.
Listen to me very carefully. That's one of my mission parameters. Personalized healthcare is becoming accessible. I'm happy to see that Dr. Castro wrote the first book on ChatGPT and healthcare back in 2022. No more interviews on the. Hi, as an AI researcher, I collaborate with medical experts like Dr. Castro to develop technologies that predict health risks, personalize therapies, and support surgical procedures. Our aim is to leverage AI to not only improve health outcomes, but also to save lives.
Video Gen AI medical imaging transformed.
The new iPhone 18 will leverage small language models. I am excited to see what applications Dr. Castro will create. He has several Apple Vision Pro applications out.
All right, next slide. All right, so I apologize. I have a little bit of cold. Okay, so why does this even matter? At the end of the day, our healthcare crisis is going on all over the world, especially here in the United States. We're spending about $4.3 trillion, and 1 out of 4 Americans have some kind of medical debt. And the older I get, the more I start freaking out because I'm like, man, I'm going to be on government insurance. And what if I'm on the wrong insurance? And what if I go bankrupt because I have some weird cancer or some disease later in life? And it honestly does freak me out a little bit. The other thing is we have a 20-minute lag time in the emergency room. So meaning you come in and the average time is 20 minutes and it's just 20 plus. But I really feel like in some parts of the US, it's like hours. And there's no need for that, especially in the day of AI. And then average prescription, people are spending over $1,500 on prescription. And to me, I think that number is low. I think it's actually more than that. The part that really upsets me is 40% of diagnoses are delayed or incorrect. Think about that. 40%. So God forbid something's happening and you have to wait and wait and we still don't get it right. And again, in the age of AI, to me, there's no excuse. That should not be happening. Let's go to the next slide. And so people ask me, Harvey, why are you so passionate about this stuff? And literally, it's this scar right here on my hand. You see, when I was about 12 years old, when I was a kid, I really thought I was going to be like Michael Jordan. I was going to be the best basketball player. And every time I walked to school, I would jump and hit the New York signs that says don't park. And that was my test to jump and practice my verticals and whatnot. Well, one day, unfortunately, one of my friends was trying to steal a sign and he couldn't get it off. And when he moved the metal, he kept trying and eventually it left a pointy object. And so when I went to hit it, when I came down, it gushed my hand open. And so I started bleeding pretty bad. I went to the emergency room. I waited for about 12 hours, went in finally to see the doctor. And I said, Doc, this is what's going on. Sew me up. And he's like, sorry, you waited too long. And I'm like, waited? I've been here for 12 hours. He's like, can I give you anesthetic? We have to do this raw. And as a 12-year-old, I'm like, I guess that's a thing. So then he sutured me up and I felt every single one. So literally it scarred me mentally and physically. And on that day, I said, you know what? I realized this was malpractice in my head. And as a kid, I said, you know what? When I grow up, I'm going to be an ER doctor. I'm going to be really passionate and I'm not going to make my patients wait. And fast forward, I actually became a doctor and emergency room doctor, and that's what I did. And so that other image is this famous case that was in the news a couple of years ago, and I'm hearing it every single day now. And basically, it's this. This poor mother had a child of 3 years old. And unfortunately, think of a child running, playing the whole 9 yards. And then 3 years later, after 17 doctors have seen this child, he was in a wheelchair. Nobody realized what was wrong with this kid. No diagnosis, delaying diagnosis. And mom's like, okay, now my kid cannot walk. And so what would any mother do? This is an AI talk. Of course, she took all the records, all the data, x-rays, CTs, reports, all of that, put it into ChatGPT, and ChatGPT said, I think this is tethered core syndrome. And as a result, she went back to the doctor and realized, yep, it's tethered core syndrome. We have to do surgery, and thank God that kid's okay. And so my point is, it's really sad to hear that this is going on over and over, and we're seeing people reaching out for an alternative, and that alternative right now is AI. Let's do the next slide. So what is this ChatGPT and all these different models? I want everybody out there just take a minute and self-reflect. These models are getting smarter and smarter. The average human being is somewhere between 90 and 110. That's roughly the IQ. Now, as you can see where the human person is, you can see these models. The Llama 2 was at 126. These newer models, as you start looking to the right, we're seeing IQs of 165, 170. And what does this mean to us here that we're listening to it? My favorite phrase is, we don't know what we don't know. But if we can leverage on these models to help us see certain things, help us compensate for some of the aptitudes on other areas, now I can deliver better care. So let's go to the next slide. So out of the entire deck of all these slides, I want you to really take time to self-reflect on this one. You see, Martek's law, to me, when I first learned about it, it really blew my mind. And ever since then, I put it in every single presentation. And here's what it says. Technology is exponential. So think about it. AI, ChatGPT, all these items is just taking off. Our organizations, think of where you work. Think of actually yourself, how you see AI. See, organizations are very logarithmic. And as the gap gets bigger and bigger, in other words, the AI is growing steeper curve and our organizations don't really change, and it's very flat, there's a gap. And when that gap happens, disruption happens. And I'll say it again, because we're not keeping up with it, and it's impossible for organization to be right next to that exponential curve, there's a gap. Now, here's the business opportunity, and here's the advantage for other organizations. If another organization can be higher and a steeper curve closer to the technology, then they can now take over the bottom organizations, hospital systems, everybody on this call. The fact that you're here, that you're listening, you're learning more than the other peers around you. And so that in itself, you are eventually going to be able to disrupt others once you start learning how to use this technology. So let's go to the next slide. So this is like my favorite phrase. That was probably like 2024 to me, and I keep saying it. It's human plus AI, and there's different permutations of that. And what do I mean? I showed you that first slide of the IQ being, how can we increase ourselves using AI? But then at the end of the day, it's about our human capability, our clinical gestalt, our personality, what makes you you, how you see the world. And you see, when you can combine your human ability plus AI and put it together, now you're able to create something greater. And I really believe that in my heart. Now, the difference is, you will see some studies out there that say, well, this AI tool actually made the results worse for you. And I say, I get it. And here's my personal take. The reason people get different outputs is because how we prompt it, how we use it. We don't know how to use it. For example, if I'm using a particular AI and this AI is biased in certain things, and I don't know those biases, and I don't know how this really works, and I just take it and use it, then I'm not using that tool correctly. But if I, that have been doing emergency medicine for over 20 years, and I know AI, and I can put it together, and I'm asking it as a doctor, I'm prompting it a certain way, I can extract a certain ability of it, whereas other people can't, as opposed to like my mom, she's not a doctor, and so she won't be able to get that same output. But again, think about it. For us that are in healthcare, we learn medical terminology. We're speaking the language of AI. And so the more we can speak to that, the better the outcome. All right, so now next slide. So as we move forward, there's different ways, and there's a pyramid of this whole thing. So as we know, maybe the AI is just being a little co-pilot helping me out, maybe do some grammar checks. The next level will be like maybe AI is actually suggesting, hey, therapy A or therapy B. As these technology gets stronger and better reinforced learning, it'll eventually, in some parts of medicine for sure, will be autonomous, meaning the AI will make that decision. And you're like, whoa, that's too much information and that's too dangerous. And I get it. But let's give you an example. Some of the pharmacies around the United States right now, or most of them, if a patient needs their insulin and they don't have a prescription and it needs to be renewed, the pharmacist has the power to renew it for one time until they get a hold of the doctor because it's such an important medicine. To me, there's so many things like that. Do we need to call a doctor? Do we even need a doctor for that? Can we have enough data about that patient, enough history to say, you know what, this medicine doesn't need a prescription for this from a doctor. It could be done automatically through the AI. And so we'll start seeing changes as we move forward. Next slide. Now, as we start looking at healthcare, we've all heard of these chatbots. We got schedule that the AI prompts you, triage symptoms, medical reminder. My iPhone always reminds me like, hey, dude, you need to take your medicine. And these are, to me, like simple stuff. To me, we need to like take it to the next level. One of the strengths for AI and my ability, my understanding for me is it's all about relationship. If I speak Spanish and my patient only speaks English, there's a disconnect. But if I speak their language, I can leverage AI. And you're like, yeah, Harvey, I know that. But let's take it to the next level. If I'm in healthcare and I'm taking care of someone in the Cayman Islands, but I don't know the culture, I don't know the feel, I don't know the mannerisms or the sayings, I may not communicate 100% with someone that's from there. But if I'm leveraging the technology to give me the right examples, the right leverage, the right, and this particular is bad, they speak English, but let's pretend it was another language. Then now when I communicate, I can communicate to them. Let's go to the next slide. And so this is old. Hit play.
Don't worry, I'm here with you. Together, we'll manage this, and you'll be feeling better soon.
All right, the next one. And that's a cool English accent that I don't have. All right, and then the next one. So my point is this. Now I can technically speak all these languages for my patients, and I can change my discharge instructions for their language, and I can use my actual voice and clone it. Back in 23, I had a podcast that I could take any website, I could throw it into AI, and within 5 minutes, it would clone my voice and do a summary of that. So like the example, when Bill Gates, he does like a monthly blog, and whenever he releases it, as soon as he released it, I would just extract it, throw it into AI, and then do a whole summary of what he said and my take to it. And it would be out into the public within 5 minutes. And people are like, how did you do that so quickly? I'm like, I didn't. It was my AI that did it. Hit play on this one. There's no audio. It's just movement. There you go. So then I thought, what about my patients that can't hear me, literally? What if I took my discharge instructions, put it into an AI, and then gave them sign language as a discharge instructions? And I thought, man, what a way. Again, it's how can we communicate with our patients? How can we use technology to another level to really help them out? All right, next one. And so as we start moving forward, there's traditional medicine. There's the language barriers, but you know what? My newer patients are now, after AI, they're expecting auto translation. They're expecting us to use the tools. I just got my Meta glasses last night, and I'm really excited because these are the newest Meta glasses with these bad boys. And then this thing can control these glasses, and there's actually a little screen here. But the coolest demo that I saw is that now, let's say I don't speak French. I can go to France, wear these bad boys, and have anyone there speak to me. And as they're speaking to me, everything is being transcribed in real time here in English. And I'm like, got it. And then I can actually hear it in English. And it's quick. I mean, as fast as they speak, it's transcribing all of it. For people that can't hear, I thought, man, this will be another one that's good because sometimes you can't hear them, or maybe they have a really thick accent, or maybe you don't get it. But if it's translating in real time, even if it's the same language and it's showing me here what they're saying, I'm like, wow, what a plus. I have a little bit of ADHD, I won't lie. Sometimes when I'm on these talks, I'll put the transcript on because I'm like, oh my gosh, this is taking forever. Just get it out. And then I'll just look at the transcript and I'll do something else and I'll come back. Again, if it's on here, then how nice would that be? This is pretty cool from a patient point of view. If I'm taking care of you and there's a new protocol in the hospital and I happen to be able to upload it here, I can just not even touch my glasses. I'm just moving my hands with this thing on me and it's recognizing my muscle movement and then telling the glasses and pulling it up. So really cool stuff. All right. And so bottom line, our patients are expecting it. Next slide. So the doctor and me, when the GPTs first came out, I thought, man, let me help my patients. So I was a little worried about releasing it because I thought, man, I may get sued for doing this idea. But I basically created a GPT and it was pretty simple. I called it Medi Helper. And the whole idea, I told my patients, before you come see me or any specialist, don't put any patient identifiers. Just say, hey, I have hypertension, diabetes, whatever it is, and then say what kind of appointment you have. And then the AI would give the patient a full list of what questions to ask, follow-up questions. And then I tell my patients, just bring it into the room with me. And so if I say something that you didn't quite understand, say it. Or if you don't know what to ask the AI what to ask me. And that way I can get the best. Because in the United States, the average time is just 13 minutes. And I thought, I need to do something for my patients. And to me, it was just a simple idea. And I was shocked how many people were using this. It was like a lot. And I'm still like every month or so, I'll get some random person be like, dude, I like your helper AI. And I thought, man, this was just like a public service announcement. It was never meant to be more than that, but people are using it and it's helping them because there's this barrier. There's this doctor way of speaking and patients. And sometimes patients won't admit that they have no idea what the heck you just said. But if the AI can be that middle man or woman, AI, whatever you want to call it, to translate, then man, what a way to help out. All right, let's do the next one. So let's hit play on this one. Underneath the picture, there you go.
Limitless pendant preserving conversations, lunch meetings, conferences, client calls, or doctor visits. Personal reflection, verbal processing, thinking out loud, capturing a thought while your hands are busy, organizing the unexpected, to-dos, reminders, or just reliving precious moments. Agenda, HIPAA compliance.
So my whole point of this is I'm wearing this thing right here and it's recording everything I say. It's kind of big brotherish. I know it's kind of scary, but sometimes I'll wear this all day to conferences or anywhere I go. And it's literally recording everything. Now, you're like, whoa, that's invasion of privacy. But let me just tell you how I'm using it. It's not quite transcribing everything. It's creating to-do lists for me. So if you and I are talking today and I'm like, yes, I'm going to write that book, or hey, I'll commit to XYZ, it's hearing it. And then at the end of the day, I'm seeing a transcript on my phone and I'll pull up the app, but you can't see it. And then it shows me the to do and be like, hey, yesterday you committed to writing chapter 2 for X way or for this book. You said you were going to pack some protein snacks for your next trip. And so literally it's extracting all my stuff that happened today. And I thought, man, what a cool way to make me more efficient because I got a lot of stuff going on. And so this pendant idea is the same concept of this. It's just you wear it and it's, like the thing said, it's copying notes, conferences. But my point of saying this is doctors don't realize that patients are using this kind of stuff and recording. Eventually, this could be a medical issue legally because what if the patient changed the words? What if you said don't and then they change and it says do? And that changes the whole context. And then this could be a lawsuit in the future. So it's just word of caution of these tools. It could be good, it could be bad. Next slide.
Technique for children. Managing asthma triggered by sports. Communicating asthma symptoms to adults.
So basically, I played a dirty trick on my mom. I played this for my mom, and my mom's like, good job, Harvey. And I'm like, that's not me. That's my AI clone. It sounds like me. And so I thought, if I could discharge my patients and give them my voice that they trust me and just another way when they're driving to hear it again, then I do that. But then the best part, I love doing this. And so again, it's this whole communication gap. Let's use technology to decrease that gap. And so for kids, this is fun. I take the discharge instructions, what the core concept, what do I need to do? I always use this example. Some person that has asthma, the kid doesn't understand their principles. But if I understand what they're to do, like how to take their medicine, when to take the medicine, what makes their asthma flare, I take those core concepts and then I convert them into a coloring book. And then instead of giving them all this minutia paperwork that the kids are going to read and some parents are never going to read, I make a coloring book and say, here you go, bud. And now they can go through and I can actually color with them, or the parents can color with them, and they kind of go through the disease. And now the kid gets it because I'm speaking their language. And so for teenagers, there's a LLMs that we can use as well to make comic strips. All right, next slide. So this is over a year plus old, but this is crazy. What it is I could take any picture, take any audio clip. So let's pretend it was me dictating a discharge instruction, and then a picture of myself. Now, with those two simple things, this AI puts it together to this. Now, and this is a year old.
Have you ever had, maybe you're in that place right now where you want to turn your life around, and you know somewhere deep in your soul, there could be some decisions that you have to make.
So it's just crazy because with that one file, it just created her emotions, her mannerisms, her speaking. And I'm like, holy cow, how could we use this in healthcare? Now, because of the election last year, Microsoft held off on releasing this because they didn't want to have issues with elections and stuff. All right, let's do the next slide. And so for a little breather, I hit the video on the far right, the second picture. And so I just did this just for fun to show you, dude, you could just prompt the AI to make you into a character, and then you can make it animated. Now, I don't walk like that, dude, but I thought it was still pretty darn funny. All right, so next one. Okay, so then the World Health Organization, this is old, and I thought, man, this was really cool. What they did is they created a little simple bot, and I'm thinking, why aren't all hospitals, why not all doctors out there creating this kind of bot? This thing is available in 8 different languages. It's always available 24/7, and it's focusing on different things like don't smoke, mental health, and basically you can interact with her right now and just ask her anything. And the lag time now is better than it used to be.
Health is my specialty, and I want everyone to live a healthier life. There is so much we can talk about, from tobacco products and alcohol to healthy living and mental
Cool.
health.
Now let's go to the next slide. Where did it go? There it is. So we won't play the video, but I'll just show it to you. So basically, I was working at a children's hospital, and I saw these cancer patients, kids, and I thought, man, these poor kids, they don't get time sometimes to really understand that they're going through chemo or they're about to get an MRI or whatnot. And I thought, what if I put AI into a plushie? And what if I could just converse with it? And what if I could just come up with different voices? And if my favorite voice is a certain character, then I put it into the AI, and then I create their schedule of where they're going to be that day. Or I can put NFC technology on this so that every time it's in different parts of the hospital, it recognizes that it's in an X-ray or it's in a CAT scan or it's about to go see Dr. Smith. And then the AI, then that child can be like, hey, I don't know what's about to happen. And then the AI can be like, well, this is a CAT scan and this is the things, and it's speaking their voice and their favorite character and male or female. And now they can really get it. And so I thought this is really the way we need to be changing medicine. Next slide. So one of my biggest honors for this year was I got to speak at the Consumer Electronics Show. For people that don't know, it's about 80,000 people that come there. 80 countries-ish go there. So I was just like super stoked because I always wanted to go to one of these shows. And big picture, I saw this and I thought, oh my gosh, I want to do this. So it's basically they're creating different holograms. So I now am helping a company called IEXA, and unofficially I'm going to be in NASA tomorrow, and we're going to be promoting some ideas to NASA. And then I'm not supposed to talk about it, but in the near future there'll be a press release about what I'm doing. But it's going to be really cool. But it's basically AI healthcare for space, and I'm really excited because it's, again, what can you guys do? Your clinical gestalt, or even if you're not a doctor, what's your profession and how can I use AI and my creativity and put it together? And what can I do for humanity or for your job? All right, let's go to the next slide. So one of the things I spoke about at CES was spatial computing or VR or AR or whatever you want to call it. And I thought we really need to be able to use this technology. Back when the Apple Vision Pro came out, I wrote the first book on how to use the Apple Vision Pro in healthcare. And it's basically, how can we use this bad boy? And when I was a medical student, I remember being scared crapless when they were like, hey, Dr. Harvey, we need you to intubate in room 2, and we're about to show you one, and then after that, you're going to do the next one. And I'm like, what? Like, I read about this. Are you kidding? And they're like, no. And I was like, oh my God, it really freaked me out. But then I thought, well, crap, why not use this bad boy? Why not learn the different intubations, the people that are obese, the people that are skinny, the different tools, how to use them, why not to use them, and then practice 100 times before I touch somebody. And I really think that's the way to go. And I really see more and more that that's exactly what is going to be happening. So this AI and this whole thing, I really think it's going to take us to personalized medicine and virtual hospitals. So I'm really stoked.